moved.
Thank you.
Second.
Second, all in favor? Aye. Great, okay. No discussion. All right, meeting open to the public. This portion of the meeting is specifically set aside for comments from the public who are asked to limit their comments to 2 minutes. Any person interested in providing public comment should email publicmeetings@rockyhillct.gov. You will be provided with the necessary link and instruction to join the Zoom meeting remotely. We do not have any in queue for tonight, so we will move to public comment that was sent in earlier. And usually when we have the Central Health District of Connecticut present, thank you, Charles Brown. We lead off with you to address the overarching public safety issue of COVID-19. So you already have a question. Do you have it in front of you? You want to read it in and answer, or?
Yes, I do. Actually, it was a number of questions, and I'll read them in and answer them as I go along, if that would be okay.
Perfect.
Okay. Let me just get to them real quick. So the questions are concerning the guidance on COVID-19 seems to be shifting a bit, and they need input from a public health professional. It seems that the virus is far more aerosolized than spread on objects such as door handles. Is this correct? And with respect to that, yeah, they are finding that spread, while not necessarily aerosolized, is much more person to person and spread via droplet. And it's not the hard surface that they're seeing actually driving the virus along those lines. So that is very correct. And it goes on to ask, while everyone should, of course, continue to wear masks and practice social distancing, can I stop disinfecting my groceries? Yeah, I mean, generally you don't have to disinfect your groceries. Washing your hands effectively, practicing good hand hygiene, and especially with dealing with your food, washing that appropriately, but you don't have to sterilize the outside of boxes or anything along those lines. Second, they said, given shifting CDC guidance, are we still talking about 6 feet or potentially more than 20 feet? And CDC has recently determined that the possibility of contracting COVID-19 via aerosol spread versus droplet does exist. It is rather rare. So, they're still emphasizing that the driving force behind the spread of the disease is that person-to-person contact within 6 feet. It's possible for aerosols, it's very small droplets, to actually someone contract the virus that way, but it is considered to be very, very rare. Third, they wanted to confirm that our drive-through flu clinics won't be offering the high-dose vaccine to seniors not comfortable entering CVS, and that is the case. Our flu clinics, we're actually halfway through our flu clinics as of today. We actually have 2 flu clinics starting tomorrow in Newington, and then our final 2 are going to wrap up in Rocky Hill. We do not have the high dose designed for seniors, and the reason for that is because we use our clinics as a test for our emergency preparedness plans. So we want to make sure that we have 1 dose that pretty much anybody can receive. So we use the quadrivalent vaccine that covers 4 separate strains of the virus because we feel that that gives a good broad spectrum coverage and protection, and anybody within the age range can actually benefit from that. Where the high dose is really only indicated for seniors. So we would have to modify our plans to be able to give that out during those clinics. So yes, we don't give out the high dose. Fourth, they ask, can CCHD or DPH provide guidance to healthcare professionals that they shouldn't be wearing KN95 masks with exhalation valves? And DPH actually does provide guidance, on PPE. I know that early, in the pandemic, there was a lot of once again, shortages of PPE, and they were utilizing some non-ideal, personal protective equipment, but that should be handled right now, and definitely healthcare professionals get their guidance from the Department of Public Health. Fifth, they ask, is there any way to mandate that healthcare professionals get regular COVID testing? That would be something that both their agency and DPH would monitor. It's not something that I can mandate as a local health director to assure that they get testing. We do know that within certain healthcare settings, depending upon the rates of infection, they do have to get weekly testing. For example, in visiting nurse, or not visiting nurse, but in nursing homes and things of that nature, they would have to do that. Those were really all of the questions that I had received previously.
Yeah, Charlie, I can speak also to that. I know from family members who work at health clinics, the clinic keeps a inventory of tests for themselves, and they determine when to take the test to make sure, and they know when they're exposed, and so they start the contact tracing with their own patient if they become exposed. So okay, that same person, Krista Mariner, submitted some new questions, and you answered the first three of them. She restated them again, so I'm gonna just pick up on the newer questions in her email as of today that came in. And and so the question is, Rocky Hill has now surpassed 500 cases, and Connecticut has entered a second wave. All 500 cases cannot be from congregated living facilities. Where are they coming from?
So that's correct. Most of the numbers from Rocky Hill actually were from congregate settings earlier on in the pandemic. We had a nice little lull in the summertime, but Christine is correct, is that we are actually at the very beginning of the second wave, probably a couple weeks into it. So that if you actually look at the graph, you'll see that we're actually starting to come back up. So, a lot of the spread at this point is actually not happening in congregate care settings as we've seen early in the pandemic. It's actually coming from small family gatherings and athletic events, actually, is where we're seeing a lot of the spread, in addition to work settings. The age range is also very different now coming into this second wave. We're seeing many younger people actually contract the virus, in their teens and 20s, early 30s, are actually the ones that are actually getting the disease at this point. And that's good news and bad news, because the good news is that they don't suffer from the mortality that we see with the older populations. But the bad news is that they have a tendency to be much more socially active and to spread the disease wider, as they go to work, as they go to school, and may not adhere to social protocols as tightly as what we'd like for them to do. So I think everybody is getting a little bit fatigued. I said the term hygienic fatigue very early in this pandemic, and we're actually seeing that being the case. So just a reminder for everyone, follow the 3 W's: wash your hands, wear a mask, and watch your distance. Those 3 things really can help to limit the spread of this disease. And Connecticut's done pretty well, though here recently we have seen quite an uptick, in cases among our state.
Thank you. What is the number of deaths for Rocky Hill?
94 at this point.
Fifth, are you concerned that Connecticut has entered a second wave simultaneously with the phase 3 opening?
Yeah, I have to say that I am concerned about that. With every reopening phase that we've gone through, I think that it gives an opportunity for this virus to spread. I understand that there's a lot of reasons why they reopen, certain segments of the economy, and there's certain things that we have to do. Once again, I think adherence to the protocols, as tightly as we can, assuring that we're wearing a mask, that we're watching our distance, really can make a difference in the spread of the disease. That being said, we're going to be watching very closely the numbers as they start to go up, and they are going up within our district. We see this in the contact tracing that we do every day. The numbers that we're asking of cases that we're asking our contact tracers to chase down are going up significantly. So it is something that we're concerned with. We're starting to see numbers that were close to what we saw in early March, as it started to work its way up. So the more that we can do individually and collectively to be able to prevent the spread of disease, the better off we're going to be in the long run, and the less likely that we're going to have to endure the shutdowns that we had to really stake this off back in the springtime.
Okay, from Krista, it's from Krista Mariner. Thank you. 58 Farms Village Road, Rocky Hill, and that concludes the questions from the public section of it. I'm going to ask you if you have a report that you want to give aside from those questions.
Yeah, I mean, it kind of touched on most of what I was going to respond to. Yes, Rocky Hill has hit that dubious number of actually going over 500 at 505 with 94 deaths. We, once again, I think, we each have responsibility for our communities and for our families. I'm concerned as we're starting to come into the holidays that, we become complacent as we're dealing with this particular virus because, you see your family and it's comfortable. I would just ask that everyone really think hard about the type of celebrations that we enter into. Smaller gatherings are, with close family is probably much better. But even when you do those close gatherings, to really think about, protecting yourself, protecting your family as a whole. You may have folks that you hadn't seen in a long time, and I know that it's tough, but trying to make sure that you're keeping your distance as we're socializing, as we're giving thanks for everything that we have, I think is very important as we move forward.
Thank you. I want to give a chance for counselors to ask questions. Counselor Emmanuel.
Actually, I don't. I think some of the explanations from Charlie were very good. So thank you, Charlie.
Thank you.
Counselor Prakash.
Charlie, I think you touched on most of the things. Do you have any insight on the schools and how they've been, been operating in our area, in our district?
Oh, I can definitely provide insight to that. I work very well with all the schools, including Superintendent Zito and Rocky Hill. They've got me on speed dial. I can definitely say that much. But where we're seeing in the schools is we're not seeing transmission of disease within the schools. And I think a large part of that is that we're having people that are being very strict with respect to their protocols for exclusion. So that when somebody's sick, they're not sending their child to school. That is a very important thing. When they do show up at school, if they do develop symptoms, parents are notified and they're quickly gotten home to where they can be taken care of. As they've been notified of cases, I really can't say enough about the schools and how quickly and efficiently they've been in assisting us with contact tracing within the school setting. We've had some really unique situations that we've been able to, walk everybody through, assure that the people that are appropriately isolated, those people who were exposed to a case, have been quarantined effectively. And we really have not seen that spread of disease within the school setting. That being said, we have had students that have been quarantined, and a lot of those cases of quarantine really come down to athletic events and participation in travel teams, where you have one case, and because of significant exposure during either practice, on the bench, during a game, where we've had to quarantine a rather large number, like entire teams. So that does affect things. The good news with that is that for the most part, with respect to kids, it's not like it used to be that they don't get behind quite so much, because they are operating in a remote environment in many ways. So even when they're on quarantine, they still have the ability to go to school, albeit just remotely at that point. So, like I said, I really have to give credit to Superintendent Zito, to all of his staff. They have really done a very good job, and we work with them very well as we go through this.
Thank you, Charlie. That's really good to know. That's very comforting. And yeah, thanks for a great report. Thank you. Very, very informative.
I'm just going to open it up to the other panelists. If anybody wants to avail themselves of Charlie's expertise at the moment, we've got him here. Any other questions? Seeing none. I think that so that's old business. We jumped forward because we had comments from the public that engaged the Central Health District. So we jumped forward and pulled old business forward. We're on to departmental reports, and fire is up first. Chief Garrahy.
Thank you, Steve. Just brief monthly report, which shows that we responded to 59 incidents. Year to date of 465, not too far off of the 491 from this point last year. Training hours were 427 for a total of 2891. In the report, you see the staffing was down just a little bit. That's not reflective of where we currently are today, as in the leave of absences, at least 3 of the administrative leaves have terminated. The personnel on those leaves have come off the leaves. The leave is over. And I believe one of the medical leaves is over also. So we're up about 65, 66 today. We have 3, we put on 1 new member last month and 1 new cadet member, and we have 3 prospective firefighters in the application process, at least one of them coming to us trained and certified. Couple other things that didn't make it into this month's report, however, they will be in October, is we completed our annual hose testing. We tested about 20,000 feet of hose, both supply and attack hose, with about 800 feet failed. So we also completed our annual pump tests, and all the apparatus have performed to the design standard. The annual aerial and ground ladder testing has been completed with 0 failures. And lastly, we are 2/3 of the way through of our annual factory certified aerial service. Once we receive all the final documentation for those 4 reports, we'll include them in our monthly report. Lastly, we're currently conducting our OSHA required live burns, and we are using the Newington Fire Department's facility. The reason being is our fire blast trailer, which would allow us to perform this required training, is scheduled for delivery in the first week of December. So the Newington Fire Department is being nice enough to allow us to use their facilities. And
This is the facility that's being replaced by the insurance carrier.
that is correct. One thing the training report doesn't cover is we sent 2 members to fire service instructor certification training. That's level 2 for fire service instructor. They are required to be at that level to conduct the live burns. And today, 1 member is certified and 1 member is, we're waiting on his results.
And
And
Chief,
yeah.
Chief, you're having a high turnout rate for incidents from staff, right? From volunteers? Your
Yes.
turnout rate is very high,
Yes, we are.
responding rate.
Yes. Let's see, our average number attended is about 18 per call, which is above the standard. So yes. You actually have that report as part of our monthly report, which gives you a manpower analysis by incident, total number of incidents, and the type of incidents we responded to. So you can, all that information is right there. But yes, we are having a good turnout.
Questions from Councilor Emmanuel,
No, thank you.
Thanks, John.
Councilor Prakash.
Very quick question on one thing. Here it says it's the RHAFD has reinstated our physical exam.
Yes, sir.
Yeah, on that one, Chief, like, was it not a continually, a continuous program? And if not, obviously, because it says reinstated, right? Can you throw some light on that?
Yes, absolutely. We provide pre-employment physical exams, and that creates a baseline of where the member's health is, as well as the required blood tests that show any toxins in the blood, whatever it might be. We have a yearly fit for duty physical, which was postponed due to COVID. And part of that was, and Dr. Brown was talking about the aerosolized transmissions. Part of our yearly physical is a lung function test, which requires breathing, and you're checking the performance of the lungs. A lot of exhalation on that one. So until the medical provider, PH, could come up with a way for us to safely perform that test and test our employees and our members, we postponed the physicals. So they were actually 3 months later than they're normally due.
Yeah, and thank you so much. So it was COVID related, which makes sense, and you have to like figure out a new method to do it. So one thing I wanted to say, like in general, I was talking to some people, and it was came to me that an interesting question which we have not asked in this group is, what is our typical response time? I mean, that definitely goes for all of you, but this is something which I would like to see in our reports, reoccurring reports, if we can have some metric of response time. I'm sure you keep it at some level somewhere. So if we can get that in the reports, that will be awesome. And
Okay.
that applies. I was going to ask Chief Custer as well, but I thought maybe something Ed said previously about responses, right? Like turning out and responses, and that brings up a question of the response time as well. So okay. Yeah, that would be awesome if it is easily available and you keep that keep track of it. Then
I'll go in our report bank and see what we have.
Okay, thank you.
Okay, thank you.
Thank you for that report, Chief Garahy. And now we're at ambulance. EMS. Thank you, John.
Thanks, Ed. For the month of September, we had 323 calls. Year to date, 3,028 calls. We have currently 75 members. We just had 4 new members that are in the process, and one of them called me today. Another person called me today, so we're at 79 people right now. If I could have gotten the application, then we would have broke 80 for volunteers. So we're doing awesome as far as that goes. Everything else is going very well. We have plenty of PPE stuff. We started doing our training classes again, both Zoom and in person. And we're going through all of our mandatory required training right now for the next couple of months. Everything's going well.
Great. Counselor Emmanuel, any questions?
Nope, thanks.
Counselor Prakash?
No, thank you, Jim. And I don't have any questions at this time, but I want to thank Joe as well, because recently I had a little bit of a scare in my own family, and response times, and how ambulance and fire and police response in this town is great. It's awesome. And I wanted to just thank ambulance as well as everybody else for that work that you do. I mean, I know it's a little bit kind of out of the blue, I'm thanking all of you, but it just occurred to me that how good a work this town is doing on all these fronts. So yeah, especially on the ambulance side, because I don't give Joe the credit every single time. So thank you.
Thank you very much. Greatly appreciated.
Joe, you had a vehicle that was in a car accident. Has that all been resolved and back in service or whatever? We're not down a vehicle.
We are down the vehicle right now. We're finishing up the process for purchasing a new one. So hopefully that will be done within the next month. And then they could start building it. They're all custom designed. So we've gone through all of the specifications with the company. They're putting a spec sheet together for us right now. And we're hoping to have it out. We're sending it out for 3 different quotes, and then we'll make a choice and have it built. It takes about 60 working days for them to be constructed from start to finish. So we're pretty optimistic.
Sure, there was some funding problem with the insurance mechanism. That gets straightened out?
Yeah, we're off with that for now.
You're good. Okay. All right. Moving along. Police report. Chief Custer.
Good evening, all. For the month of September, we had 2,071 calls for service to our dispatch center. We had 23 criminal arrests for the month. We investigated 36 motor vehicle accidents. We had 2 DUI arrests, and we issued 16 infractions and an additional 44 warnings. And for community service events, they've been kind of low to non-existent lately because of COVID, but we were able to install 5 car seats, children car seats for the month of September. In terms of staffing, presently we have 3 patrol officer vacancies, and we are anticipating an additional 2 retirements as of November 1st. So we're working right now to fill those 5 vacancies, 3 plus 2. We recently had a advertisement for certified officers only, and after a round of interviews and screening, we came down to 6 candidates. So we're in the process of interviewing them a second time and making conditional offers, I should say, to try to fill at least those first 3 vacancies. So that's where we are right now, background investigations and conditional offers. In addition to that, we have 2 officers at the police academy, and we have an additional 2 officers who are scheduled to finish their field training this week. So that will help us immensely when we get them on the road starting next Monday. The only other staffing news I wanted to share with you is last Friday we promoted Laura Carta to the rank of sergeant. So this gives us our full complement of supervisors, but perhaps even more noteworthy is the fact that we believe Laura is the first female sergeant in the history of the Rocky Hill Police Department. So congratulations to her. Other than that, I just wanted to announce that on Saturday, October 24th, from 10 a.m. to 2 p.m., we're going to be participating in that National Drug Take Back Day. Again, Saturday, October 24th, 10 to 2. So that's going to be held at the front entrance of the Rocky Hill Human Services on 699 Old Main Street. And it's going to be a drive-through event. So people who wish to drop off their prescription drugs can drive through the semicircle. Please wear a mask, and we'll hold out a box. They can put all this stuff into the box and then just drive on through, and easy in, easy out. The only thing we do ask, just prescription medications, no syringes, please. Other than that, I don't believe I have anything else noteworthy to report.
Sure, I have a couple questions from caucus, from their Republican side. Just one is, we are receiving fielding inquiry, complaint, whatever you want to call them, about speeding, and it looks like in your numbers you're starting to really address the speeding issue around town. That's an uptick.
I'm not sure if you have specific locations, but I can tell you we have picked up the speeding and traffic enforcement. I have some locations here if I can find it. And we're also putting out the speed trailer to record speeds to get a grip on how bad they may or may not be. So for the month of September, I know that we focused on Bailey Road. That was one street where we had some complaints. We also had speed trailer and enforcement on Boulder Drive and Woodfield Crossing as well. So again, I'm not sure if it's any of those locations, Ed, but.
Well, in particular, Cromwell Avenue, Route 3, kind of down by the 91 on off, that end of Cromwell Avenue.
Okay.
We're just wondering about the speeding in that area. Have you seen any or heard anything about that area? And do you think that the shopping center, the newer one, and the apartments have caused any uptick in that traffic area?
That off the top of my head, I couldn't answer. Again, we'd probably have to, we could put out the trailer and get a traffic count. But I'll check with the patrol commander about Cromwell Avenue. I'm not aware of any specific complaints, but we can certainly target that area.
Okay. I guess that's the corner of Cromwell and West Street, that area. So I guess one of the other questions, how can we slow down traffic? You know, what is at our disposal? And I guess it's the speed sign or a cruiser, a manned cruiser sitting watch. But where I guess that question parlays into the idea is, can we ask the Department of Transportation to send a representative to next public safety meeting to talk about signage, speed limits, lighting, you know, the traffic light sequencing, you know, kind of give us some ideas there and see if there's something we could explore with that. Does that sound or make sense from your point of view?
I might defer to the town manager on that one as a traffic authority.
I think it's easier said than done to try to get somebody to come out from DOT. We could attempt it, but there's no guarantee that they'll be on a timely basis and so on. So it's kind of a steep request, I would say.
Oh, okay, maybe we could just make the invite and then see where it goes from there. And if we're lucky, we're lucky, and we'll manage from there. Thank you, John. Any questions for the police from Councilor Emanuel?
Mike, with going back to your comment about the applicants, have you seen have you had any concern about the quality of applicants with everything going on, both nationally and with the police accountability bill that maybe some people just aren't interested anymore?
Yeah, well, as a matter of fact, John, I have been concerned about it on two fronts. One, you addressed the diminishing pool of interested candidates. And then the second piece of that, you know, because of our pension situation, which you're aware of, you know, if we continue with the revolving door, I'm fearful at some point, just because of sheer numbers, and in this case, diminishing numbers, that at some point we're going to have to lower our standards. And I don't want to do that. We've worked so hard to get to where we are, and now we're finally, you know, professionally accredited and so forth. So it hasn't played out as of yet, but I'm concerned in the long term that if things don't change, it could be a problem. This past go around of hiring, we seem to attract some very good quality candidates. We went with the certified officers again because, you know, being down 5 officers is significant for us. So I can't afford putting all of those vacancies through the police academy, and it's going to be a year before they're on the street. So at least with the certified officers, there's usually a turnaround time of 90 days or 100 days. So we can get them up and running and on the street a lot faster. Those candidates look good. Again, we're still doing backgrounds. I'm just concerned in the long term.
Okay, thank you. Thanks, Ed.
Councilor Prakash?
Yeah, Chief Custer, I will, the question I had, these charts you produce now are really great. Like, thank you for doing that. Gives us like such a clear view. So quick question on September numbers on the motor vehicle theft, right? Clearly it was an uptick, like the trend was going up like for last 6 months almost, right? And then it kind of came down, although it's just one data point, but it did come down. I was wondering if you did anything differently this month, like from an enforcement perspective, or is it kind of a blip and then, you know, you'll be back to where I mean, I hope not, but I was just wondering if there is something operationally you are doing differently.
I mean, I'm going to be honest with you, Pankaj, for the most part, it tends to be hit or miss, but I can tell you, we have been much more active the last 30 days, patrolling the areas where we've had these stolen cars in the past. So I'd like to think maybe that increased presence has maybe made an effect. I can't say for sure. Stolen motor vehicles certainly went down this month. But unfortunately, the theft from motor vehicles went up slightly. So we had 23 for the month of September, and it's just 23 too many. All cases, cars left unlocked, valuables inside, and keys or fobs generally in the car as well. We did have a couple instances where they actually got into garages and were able to steal vehicles out of the garage. So again, you know, with other public safety messaging that we've had in the past, make sure even if your car is in the garage, the keys are not inside, and that door to your house from the garage is locked as well. So I don't know if this is a new trend now or it was just a blip, but we did have a couple of instances where that happened.
Thank you.
Thank you, Chief. We'll now move on to emergency management. James Bellinger.
Good evening. On September 15th, the Rock Hill Emergency Operations Plan, the final update was released and submitted to the state, and a updated copy is posted on the emergency management section of the town website. On September 30th, I submitted a draft plan to the Rock Hill Public Schools for their safety and security plan, awaiting feedback. We found out from the state of Connecticut that submission date for November 1st has been extended to December 1st based on COVID and everything that the schools have to do. In regards to COVID, we have decided to postpone our 2020 emergency exercise for all of our partners. We figured between social distancing, the size of the venue needed to keep everybody separate, and the comfort level for all participants that we would reschedule for 2021. We haven't set a date yet. Everybody was notified via memo last Friday. It was sent out.
James, this is the exercise where you set up a command center and you have all the players around a table and you go through a mock event.
Yes, we've done it as a tabletop exercise previously, which is a scenario presented out, and it's a discussion-based response. Usually we have anywhere between 25 and 40 people in the room. So just based on where we usually have it, which is the EOC, there wasn't enough room for social distancing. And another venue that we could try to use wasn't available. So we're going to try next year. On Wednesday, October 14th was our monthly EOC meeting in regards to COVID response. So overall, for staffing and equipment levels, everybody's maintaining good levels. The shortness was in the N95 masks. Emergency management ordered some masks, so we delivered extra small, medium, and large to the police department and the Board of Education today. There was a significant discussion in regards to the governor's executive order 9G, which is the rollback from phase 3 to phase 2 based on the number of cases that are presented in our town. And what we're doing is we're working with the health district and letting them give guidance to us in regards to what we would do after they deal with the state of Connecticut and the BPH.
So you're working with the Connecticut Central Health District and our town manager, John Mayer?
Yes, and we're taking guidance from the health district in regards to what needs to be taken based on the executive order. And the only other thing I have is that today we were noted, the state of Connecticut sent out an email that the U.S. Department of Agriculture did a disaster declaration for the drought, primarily out of Litchfield County, but surrounding counties also get included in that, which is Harford County. And with a disaster declaration, it'll allow farmers for certain assistance under specific guidelines. There's further information going to be sent out by the state later on. And that's all I have.
All right.
That's all I have for this month.
Okay, we'll have to get that over to Farmland, Land Preservation Committee. Okay, all right. Any questions for emergency management from Councilor Manuel?
No, thank you.
Councilor Prakash?
I'm good, Chairman. Thank you.
Thank you.
All right. Sounds like we're good on reports. Any other business or new business? We're down to new business. A, 5-town non-emergency interagency agreement. John?
Mike, you can help me with this, but it's, I think every 5 years, the 5 towns, Berlin, Cromwell, Newington, and Rocky Hill and Weathersfield Police Departments signed a interagency agreement, I guess, to provide services when other towns requested from the current towns. You have any, you can probably explain it better, Mike, than I can.
No, that's pretty good. This agreement's been in effect and around for about 15 years now, and it's worked out really well for us. As John has mentioned, every 5 years we just like to go over it and review it and see, iron out any issues or problems, if any. And the benefit of this agreement is it allows the 5 towns to pool our resources, specifically officers, when we get involved in certain types of activities or investigations. For instance, we've pooled our officers from the 5 towns and created a regional, we call it a regional. It's also called the Mid-State 5-Town Collaborative, whatever you want to use. We've selected officers from every department to be on a regional traffic unit. and we operate in all 5 towns. We've also done the same with an accident reconstruction team. And again, it's a benefit that all 5 towns enjoys by having this participation. We've also created a major crime unit now with the 5 towns, and on an as-needed basis, a narcotics unit as well. So basically, the 5 of us aren't big enough to really be able to provide those services full-time with just our staffing. But when we pull officers from all 5 towns onto those units, it works out really well. So, you know, we just like to keep it going and continue to use it as it is right now.
So there's nothing for a public safety committee to do other, John, I mean, you guys are just moving forward and signing this and presenting it to council?
It's on the consent agenda. If you want to just mention it in your report, Ed, to the town council.
So we recommend approving it on the consent agenda. Yeah, well, consent agenda means it's approved. Yep, gotcha.
Okay, I just want to make sure, I mean, we get any questions out of the way first, Ed, right?
Yeah, I mean, you have questions,
I know,
John?
I mean, I just want to make sure this is, Mike, this is just a formality, right? I mean, things have been going fine for the last 15 years. Nothing major changes this round.
Correct. And
Okay.
I think the idea was, you know, if we have questions, you know, now's the time to ask them and discuss any issues, of which I have none. So I think if the Public Safety Committee endorses this, it can go right through on consent agenda.
Okay, great, thanks.
Okay, so Chief, you're endorsing it, and John Mayer, from your point of view, you're good?
Yes.
Yeah, so I also have like just a couple of questions, Chief, like very much in line with John's question, right? In terms of services, nothing is changes. It seems like it's very specific tasks and services and kind of law enforcement issues you tackle in this group of 5, right? And it seems like, you know, there is a cost and there is a benefit to it, and you don't see that equation changing this time around, right? Like, you know, the costs are not going up or the benefits are not going down or vice versa, right? I mean, any variables moving that way.
Yeah, I don't see any significant issues in the near future. And like I said, by pooling resources, it works well for us. So take, for example, if we had a fatal motor vehicle accident in town, that would take up a sizable number of officers to investigate. And those tend to be long-term investigations. By having like this regional team, we can call in the other officers. There's no charge to our town. They come in and they assist our officers with the investigation. All of them have been trained. So all these officers on these little units have been trained. So it works out quite well for all of us.
Yeah, and there is data sharing and things like that. Additional benefits probably there.
Right. The other thing this does too is this gives us cross powers of arrest in the other towns. So let's say we wanted to do a DUI checkpoint in Newington. So our officers, by signing this agreement, would have the powers to arrest in Newington or Berlin or Wethersfield. And that's the beauty of this interagency agreement.
Right. And who oversees this? Because there was an interesting sentence somewhere, I've lost track of it now, but there was a group of like, I'm guessing individuals who like oversee this agreement, I guess.
It's actually the
right?
5 police chiefs.
Okay. Awesome. So yeah, and you have been a member for a while. So, I mean, you oversee everything. Okay, good. I'm good with that. I'm good with generally like whatever the chairman proposes next in terms of next steps.
Just while I'm listening to you guys talk a little bit, just curious, there is a large piece of machinery. It's a special vehicle. Isn't it housed in Newington? Does that fall under this agreement?
Yes, that's part of it. That's part of the resources.
What is that? Where does that? I'm not seeing that.
I don't think the command post that's a mobile command post. That's not mentioned specifically in here. It's just in general, we have the ability to use each other's resources if needed.
Okay. All right, I don't think we have any, I don't think we have any concerns, so I think, and I don't think we have to take a vote on that. I think we're good to allow it to stay on the consent agenda. Item B, Commission of the Veteran Affairs recognizing town's public safety at the November 16th, 2020 Town Council meeting.
This is just to notify, notify the police, fire, and ambulance to attend the November 16th Town Council meeting. It's supposed to say Commissioner of Veterans Affairs, Tom Sadi, will be coming over and sending providing a certificate of appreciation for the services that the town's public safety divisions provide to the veterans home.
So we may be live for that meeting.
Yeah, it'll be at the beginning of the town council meeting.
Yep. Mhm. So, okay. And then, does anybody have a problem with the proposed schedule of meeting dates for next year, which is in your packet? Any discussion? Any
Yeah,
discussion?
I don't.
I'm good as well. They look good to me.
So if you like, you could adopt it tonight. It was basically a draft to throw out and pretty much following the same schedule as past years, usually the third Monday at 5:30, except for holidays. Then it moves to Tuesday.
Yeah, that's a good point, John. I'll make a
Do
motion.
I have a
that we
do I have a
accept-
motion? Yep.
One thing I
Yeah,
was gonna
I'll
check
make a
with-
motion that we accept the
One quick question.
2021 dates.
One quick question before we make the motion. If it's
If we've got a
You can make a
motion and
Second it and then make comments.
second it, and then we can have discussion.
Yeah.
Do I have a second?
I second it.
Any discussion?
Yeah, so thank you. John, is there a way for these Tuesday meetings, and if we can't, but is there a way to move those to 5 o'clock instead of 5:30 on the Tuesday ones, on the top ones? It's just two occurrences really. If it works for everyone.
No, so Lynn, 5 o'clock for the January, February meeting.
Yeah, those are the only ones. I was thinking if we can move half an hour up.
So I don't have a problem with that. Councilor Emmanuel, do you have a problem starting at 5 on those two moved dates?
No. No, that's fine.
Chiefs, are you good? Probably. Okay. So then you're making a friendly amendment to amend the start date of Tuesday, January 19th and Tuesday, February 16th to
Yes.
5 o'clock.
Yeah, I would like to put that amendment in the record, Chairman, if I can.
Not really sure on the protocol, but do you accept the friendly amendment, Councilor
Yeah,
Emmanuel?
no, you're correct, Ed. Yeah, I accept the amendment.
Do we take a vote here to adopt?
Yep.
All in favor? Aye. All right, we adopt it with the two changes as noted. Other business? John, do we have other business?
No, nothing else.
I have a motion to adjourn.
Motion to adjourn.
Second.
All in favor? Aye.
Aye. Thanks.
Good night, everyone. Thank you.
Thank you, guys.
Thank you.